Hi everyone, good morning. My name is Neha. I am a registered physiotherapist working at Pro Action Health and Performance located at 308 Palladium Drive. I believe in continuous education, and as a part of it, I have done a couple of certifications. I'm a pelvic floor physiotherapist, pre and postnatal care therapist, McKenzie methods, acupuncture, dry needling, Mulligan mobilizations, and with movement, and I'm also a GLAD certified therapist. So today we're going to discuss about two important topics. One of it is osteoarthritis, another one is pelvic floor physiotherapist. Let's talk about osteoarthritis. What is osteoarthritis? Osteoarthritis is a disease that affects the whole joint. When I mean the disease that affects the whole joint, most people think that osteoarthritis is a disease of the bone and they assume that it only affects the joint. But osteoarthritis is a condition that affects the joint as well as the soft tissue surrounding the joint. If you see in the picture below, it explains that bone on bone. So a lot of people, this is the most common word that is used with osteoarthritis. Like they say, "Oh, okay, I have bone on bone." Yes, that's correct, but it also do affect a soft tissue structures like meniscus, bone spurs, and the breakdown of the cartilage. So it is a most common reason for not being physically active is one of the most common reasons. And osteoarthritis is a painful condition caused and influenced by many joint and their person specific factors and symptoms. How common is osteoarthritis? Most common lifestyle diseases in people over 65 years of age. It is more common than high blood pressure and diabetes. Yes, you heard it right. It is one of the most common disease and it's more common than blood pressure and diabetes. Knee and the hip pain is common in 30% of the people aged 45 or above, and 50% of the people with serious knee injury develop osteoarthritis 10 to 15 years later. So, what is the treatment for osteoarthritis? I am glad that I'm going to talk today about a GLAD program. So you're going to learn what is GLAD today. So GLAD stands for Good Life for Osteoarthritis Denmark. So this program has been first started with in Denmark, and after a lot of research and education into it, they found that this program has been working wonders for osteoarthritis of hip and the knee, and that's when countries like Canada has started to adapt it. So it's a 6 to 8 weeks of an exercise program which involves exercise and education. This helps for maintain relieving the symptoms of stiffness and the pain around the knees or the hips. So research in Denmark shows participants report less pain, reduced use of painkillers, fewer individuals on sick leaves, and being more physically active. The GLAD involves 12 neuromuscular exercise sessions, 2 to 3 education sessions, and the data collection for quality monitoring. So, this is the treatment pyramid for osteoarthritis. If you see at the bottom of the pyramid in the green, which is the first line of treatment, which involves education, exercise, and weight control. So, who usually are eligible for this first line of treatment? All the individuals. So let's say people who have affected with osteoarthritis has started with the first line of treatment. They go on education, exercise, and weight control strategies. For some reason it did not work. That's when they go to the second line of treatment, which is pharmacological pain relief like your Advil, Tylenol, etc., and passive treatments like physio, massage, chiro provided by the therapist. This would be the second line of treatment, and only some people will have to go through the second line of the treatment. The third line of the treatment, which is the surgery, is only allowed for few individuals because they would be fixed either in the first or the second line of treatment. So, if you see the treatment pyramid, the first line of the treatment is for everybody, whereas going to the third line, which is the surgery, it's just for few individuals. What can you expect from participating in GLAD? Less pain, less need for pain medications, and improved walking speed, and greater ability to manage daily activities, and higher quality of life. Let's now talk about pelvic floor physiotherapy. Pelvic floor is a larger umbrella, and there are a lot of conditions that can be fixed with pelvic floor physiotherapies. I would like to discuss some of them in today. Pre and postnatal care, urinary and fecal incontinence, cesarean rehab post pregnancy, pre and post surgical rehab, and pain management and scar tissue management. These are just a few topics that I have chosen to cover under pelvic floor physio, but there are many more in the list to be added. What actually is a pelvic floor physiotherapy? So let's talk about the pelvic floor first. Pelvic floor involves a group of muscles, ligaments, and the tissues that are located in the pelvic area, and they play a crucial role in supporting various bodily functions. Pelvic floor therapy emerges as a vital intervention, offering a range of both benefits for men and women. Here are some key aspects highlighting the importance of pelvic therapy. Addressing common issues like incontinence and pelvic pain. Pelvic incontinence, pelvic floor therapy is highly effective in managing and treating urinary and fecal incontinence. It helps strengthen and condition the pelvic floor muscles and significantly reduces or eliminates these issues. Pelvic pain. Experiencing pelvic pain can find relief through targeted therapeutic interventions, addressing muscle imbalances and tensions. Postpartum recovery. When women have undergone childbirth, often changes in the pelvic floor function happens. So pelvic floor therapy is instrumental in aiding postpartum recovery, addressing issues like pelvic organ prolapse, supporting and restoration of the muscle tone, supporting the pelvic pregnancy. Pelvic floor therapy provides valuable support during the pregnancy by helping women maintain optimal pelvic floor health. This condition can contribute to smoother pregnancies, reduce the risk of complications, and aid in postpartum recovery. Moving on, preventive care. Proactively engaging in pelvic floor therapy can prevent the development of pelvic floor issues. This is particularly relevant for athletes, individuals with sedentary lifestyles, and those prone to muscle imbalances that may lead to pelvic floor dysfunction. A lot of athletes, especially runners, they usually complain of urinary incontinence that while they were participating in the sport related activities. And I see them on a regular basis for the pelvic floor physio. Individualized treatments. Pelvic floor therapy is tailored to individual needs, considering factors such as age, gender, specific health concerns. This personalized approach ensures that each person receives targeted care to address their unique pelvic floor challenges. In conclusion, pelvic floor therapy is not merely a specialized treatment but a fundamental aspect of overall health and well being. Its importance lies in its ability to provide targeted solution for a wide range of pelvic floor issues, contributing to a healthier life. Regular engagement in pelvic floor therapy empowers individual to make a proactive step towards optimum pelvic health and long-term well-being. Thank you.